When Dr. Smith asked me to participate, and she told me what the title was going to be, I thought to myself, I don't belong there. Because basically, I'm a dentist, and autoimmune disease, what can I contribute? And so she said, you have to come. And I said, okay, I'll listen. And she said, no, but please come and contribute. And I started thinking and reading and doing some research, and I realized that I had been seeing a lot of autoimmune disease without recognizing it or categorizing it. And it hit me that certain things were going on, and like I would see a patient that had, and again, you and Dr. Fury are in the minority in physicians today as far as examining and looking at patients instead of going on a computer and trying to check blood tests. And you're very lucky if he's your doctor. And, you know, his view is one of a broad picture, and I really respect that. Going back many years, it used to be that physicians treated families, and they would know the parents, the grandparents, the children, and without computers and without DNA testing, they had a mental catalog of what was going on in these families, and they could recognize this, and they could predict what was going to happen without the DNA tests. And today, with a much more mobile society, we don't see families. I see people coming in, and I have no historical connection with their parents or their grandparents. They're a blank, and you really have to start figuring it out. And I had a patient come in a number of years ago, and she came in, she was 42 years of age, and her complaint was that her teeth were loose. And she had gone to two other dentists, and they suggested pulling the teeth and making dentures. And 42 years of age, to lose your teeth is a little unacceptable. I looked at the patient, and she had a rash on her legs and arms. Her lips were very pale. The eyelids were pale. And she was very fatigued. And she had bone loss in her mouth. And I thought to myself, this is not a dental problem. And I told her husband and Marcia that she should go have some blood tests done. And I referred them to an internist who did the blood tests, and a couple of weeks later called me and said, it's a dental problem. There's nothing wrong with her. I said, what? No, there's nothing wrong. Her blood is perfectly normal. So the husband got irritated at me because it had cost him $800 for these blood tests. And he said, could you please take care of her teeth? And I said, I really don't think it's a good idea. There's something going on. She must have a blood disease and a bone disease. So they left, they didn't come back, and he called me about 5 weeks later that she had collapsed in Paramus, New Jersey, and they took her to the hospital, did some tests, and they found that she had autoimmune hemolytic anemia and Gaucher's disease, which is a genetic disease. He called me and he said, you know, I'm no longer upset with you, but how did you know she had a bone disease and a blood disease when the internist you sent us to said she's fine? He said, how do I sue him? I said, first it was me, now it's him. I said, let's take care of your wife. Anyway, so they treated her, and we eventually treated her teeth, and we kept the teeth, and she survived. And, you know, I just think it's very interesting, and that's where he's wonderful, Dr. Nagahavi, is that he goes into things deeply instead of just doing a test. The title of today's forum is Autoimmune Disease. And, we find that these diseases can be genetic, they can be influenced by genetics, they can be influenced by environmental factors, they can be influenced by drugs, they can be influenced by alcohol abuse, opioid use, all kinds of environmental and dietary factors. One of the things that I was laughing at with respect to Dr. Nagavi's presentation, there was a cartoon in the New Yorker of two guys standing at a bar drinking. And one guy says to the other guy, all this junk about you should eat right, you should exercise, you should go to your doctor for checkups, and you really have to take care of yourself. And what happens? At the end, when you're old, you get an extra year when you can't do anything. Well, I had a thought process that if we went back and take a person, man, woman, anything, and they have relatively perfect DNA, and they're unaffected by stress, they're not taking any medication, they never get any diseases, and they're fairly happy, they don't have financial worries, and this person could probably live to be 100, 110 or whatever. And then if we throw in destructive forces such as aberrant DNA in the genetic chain, and you put in environmental factors, and you put in obesity, and you put in lack of exercise, and you put in medications. Some of my patients are on 9 and 10 medications. What you're ultimately doing is taking this 100-year possibility and diminishing it to 75, 65, 55. And all of this is concerned with what their DNA was showing. And the DNA can be from uniparental, both parents, or it could be a mosaic from grandparents, and it's very difficult. And from what I see, my job is so easy. A patient comes in, we look at them, we examine their mouths, we take x-rays, we see decay, we see bone loss, we see mobility, we can do implants, we can do fillings. And, for me, it's a simple job. And I used to think it was difficult, but after you do it for a number of years, you should become relatively good at it. But his job is complicated because so many of the people I see have symptoms of basically autoimmune diseases. And how do you separate out these symptoms? Like I see people with dry mouth or dry eyes, but they don't have autoimmune disease. The dry mouth is caused by all the medications. 90-some-odd% of medications that people are on cause dry mouth, and dry mouth causes decay and bone loss. So he's looking at people with dry mouth, dry eyes. We see people, I have people get out of the chair and they go down, and they seem to have some form of orthostatic hypotension. Now, orthostatic hypotension is one of the components or one of the identifying factors in autoimmune disease. And so rash, orthostatic hypotension, dry mouth, bowel problems, all of these things present to a physician, and I think it's very complicated to sort these out and come up with what they have to do. Some of these people have heat intolerance, some have osteopenia, some have leukopenia. I had a patient a couple of months ago who had a form of thrombocytopenia, and he came in for a minor dental procedure. And I couldn't stop the bleeding, even though I did nothing very much in his mouth. And I said to him, "Are you doing anything or taking anything? You have a very low platelet count, and you are not coagulating properly." He said, "Well, I take an aspirin every day." So I said, "Why would you take an aspirin if you have no platelets?" He said, "Well, my internist told me to take it." I said, "You know, if you ever take an aspirin again, don't show up at my office." Anyway, so besides all of these, there's fatigue, inflammation, muscle aches, and joint pain. But again, these are common with many other diseases. So again, I'm glad I do what I do and you do what you do. Now, just to give you another example of things that are difficult, I have a patient who has orthostatic hypotension, and he had gone to University Hospital and had about, 8 to 10 different tests, and they found nothing wrong with him. But he had very poor balance, and he claimed he was lightheaded all the time. So I sent him to someone else, and they checked his blood pressure standing and sitting. And they found that there was a 40-point difference. If he was 160 sitting, he was 110 or 120 standing, and he was woozy. And eventually he was diagnosed with a condition called multiple system atrophy. And multiple system atrophy is not actually a disease entity in itself, but it's a category that's created to throw people into that you can't diagnose as one disease. And it has components to it of Shy-Drager, it could have Bradbury-Eggleston, but they're all different. Shy-Drager is on a cerebral level, and the Bradbury is on a local somatic level. So eventually, I tried to convince him that he didn't have multiple system atrophy because he's had this now for 2 to 3 years without any progression. And finally, he went back to the person that diagnosed him as multiple system atrophy, and he asked him, "If I have this disease, how come I went online and read about it, and how come I'm not getting worse?" So the doctor said to him, "Well, you have multiple system atrophy, but it's minimal." And, my feeling is that the guy couldn't give up his diagnosis. So, then we have conditions which are autoimmune, like lichen planus that we see in the mouth. And lichen planus can be on the skin, it can be in the mouth, on the mucous membranes, and it's a lacy white network that appears. And it's usually not painful, and it's self-ameliorating. But the thing that I noticed about it is the factor that when someone is very stressed due to familial problems, financial problems, when they come in and I examine them, it's all over the mouth. And I'll say to him, "Are you under stress?" He says, "Oh, you don't want to know." And then when it clears up, he's no longer involved. Something was settled. So there is a definite mental stress component to some of these autoimmune diseases. And I'm sure you see it all the time. Again, what's difficult is you have people who will have muscle and joint pain, and they could be diagnosed as rheumatoid arthritis, osteoarthritis, polymyositis, and yet you can produce some of these symptoms by being on Lipitor. And I've had people that were in agony, couldn't get dressed, and it wasn't rheumatoid, it wasn't osteo, it was Lipitor. So I think that I get to appreciate how complicated your situation is. So I think that's all I'm going to go into, and if we have any questions, I'd be glad to answer them.
Some of us of a certain age have been prescribed low-dose aspirin for maintenance purposes. Not that we have anything wrong with it that requires aspirin. Are you suggesting that we not take these?
Oh, no, definitely you should. No. No, I take a full aspirin every day for the last 35, 40 years, yeah. I don't want to be considered a child and take a child's aspirin.
Well, my doctor
No,
told me to take the low dose.
Yeah. Well, that's 80 milligrams, but I do the full,
Yeah, that's okay.
yeah. No, but I've been on that for 35, 40 years, yeah.
Well, mine not quite that long, but a long time.
But what about when people are taking omega-3 and flaxseed? Because that acts as like an aspirin too. Like for instance, flaxseed, the omega-3s, because before you have surgery,
Yeah,
you
all-
cannot take those supplements because you bleed just like as if you're on aspirin. You
I-
know, so
No, but I do that too. I take flaxseed and I take omega-3 and I take cod liver oil and I take all, and I do take the aspirin.
But the nutritionist was saying to me that's an overkill because the flaxseed, no, but the omega-3 and the flaxseed
Yeah.
does the same thing as the aspirin. So
But-
you have to be careful when you're taking.
But you know
both.
something? It all depends on the DNA and the genetic background as to how these things affect you. And what might affect you might not affect her.
Yeah.
And for me, I'm waiting. You know, yeah, nothing has killed me yet. No, but it's like Woody Allen used to say, he goes home at night, sits in a comfortable chair, and waits for his heart to attack him.